Thank you so much for joining us for our Systems for Action Research and Progress webinar series. This is an ongoing series where we have researchers in the Systems for Action Research Project join us and provide some updates on their research project as it progresses. If you're not familiar with Systems for Action, we are a signature research program office of the Robert Wood Johnson Foundation. We're located in Denver, Colorado, at the Colorado School of Public Health. And our mission is to fund research across the country that aims at aligning and integrating across the medical, public health, and social service systems with the goal of improving health equity and also dismantling forms of structural inequities and racism. So today you're going to be hearing from one of our projects that received a developmental grant from our 2022 funding opportunity. This is the first of that cohort that received funding that's going to be presenting here in our series over the next couple of weeks. This team is located at Tufts University and partner very closely with Shiloh Baptist Church. And they are going to be talking about their faith and hope for equitable systems alignment. Before we get started and before I hand it over to the research team, just a couple of housekeeping items. We do record these webinar series, so we will send an email out to everyone who is registered for this event with a link to the recording and also a PDF of the slides. And we'll also follow up with any other resources that the research team might want to share. If you have any questions at any point during this presentation, please locate the Q&A box at the bottom of your Zoom screen and enter in your question, and we will make sure that we save some time at the end of today's session to address your questions. So with that, I'm going to hand it over to the research team. And I think we're starting with Allison. Or do you want
Armstrong?
Yeah, good evening, everyone. My name is Darrell Armstrong. You'll see
Hey, Reverend.
about my background. We're excited to be a part.
Reverend.
Yep.
You're cutting out a little bit. I wonder if we turn off your video, if that might make the voice come through a little bit clearer. Should we try that?
Yeah, sorry about that.
Okay. Technical issues, they happen.
Absolutely. Good afternoon, everyone. Is that better?
I think so. I think it's going to come through more clearly. Thank you.
Okay. Great to have all of you. We're excited to be a part of this research effort with Robert Wood Johnson and their Systems for Action. And so we will be hearing a little bit more as we go through the presentation about my background. But in addition to serving as the clergy, I've worked in as the director of our statewide prevention from 2006 to 2009. And so really excited about how we integrate both our faith, religious, spiritual work to better engage and strengthen families.
Great. I am Allison Stevens, and I'm also a co-principal investigator on the project. My background is in family and community engagement, and I'm here today from the Hope National Resource Center, where I serve as Director of Networks and Policy, and also Assistant Professor of Medicine at the Hope Medical School. So this is an interesting project to me because it's an opportunity to combine some of the things that are important to me as a community with the research that I think needs to happen in order to address some of those issues that we heard about at the beginning with Carrington. So this is a little bit more about me if anybody is interested. And then our next participant, who will be here in words only. So she has shared her thoughts and I will read those, but that is Amber Robinson, and she is a parent leader and advocate. I just want to highlight that Amber is a part of our research team and is helping us to craft materials that are aimed at supporting families and helping them to understand a little bit about our framework and overall participation and advocacy. So Amber is an integral part of the team. And as you'll see, that is a part of our desire to highlight and center things on lived experience. A little bit just to explain who we are. First, this presentation will give you some significant background and context for the project. I think it's important because in absence of that, it gets a little complicated to figure out what we're doing and how we're doing it. So one, the Hope National Resource Center is an organization within Tufts Medical Center where we, Dr. Bob Segi that you see at the top left, has worked to develop a framework based on some research that we will discuss in a moment. And we all work to disseminate that research. And we do that in a number of ways. So you can see we provide training and technical assistance. We also try to build public will for policy change. And we connect with organizations, professional leaders, and then we also have our Faces of Hope, Family and Community Experts Council. We are currently working on developing a certifications process for organizations. We currently already have like Train the Trainer and other facilitator programs. One of the things that's really critically important to us is anti-racism. So I wanted to just share this. Of course, there's more information on our website that details this, and that's positiveexperience.org. But we have taken deliberate steps to integrate and weave anti-racism into everything that we do. And we are monitoring progress on that. So we do have a formal statement that you'll find. We also now have an online course that Dr. Segi and I teach together that is free on our website. We have this document that is Hope as an anti-racism framework in action, and a lot of other examples. So as you can see, we're already starting to connect the dots as to why this project is important to us, because it fits within our goals and our understanding that anti-racism is important and dismantling systemic racism is also important. So one of the things that I mentioned is that we do connect with people outside of the organization. And so when I said that my title is Director of Networks and Policy, I was not talking about computer networks, or back when I used to work in managed care, we had network providers, but really the network of the organization across the board, and who's heard of Hope, and are we gathering the information we need to move forward. And so I was able to connect with Reverend Armstrong when I joined the Hope team and started supporting the National Advisory Board. And so he is a wonderful, passionate member of the advisory board and was one of the first speakers at our summit. And so that's the connection. We were able to utilize these three methodologies to be able to expand our network and to include people such as Reverend Armstrong, with whom we can collaborate on multiple projects. So just to give you an idea of what that looks like, this is our growth, basically, from workshops, facilitators, and champions. So we just started the champion program, so you can see that that's going up, but you can see it's pretty significant. I would say even exponential growth that we've had over time. And also a lot of trainings that touch a lot of individuals. We cross all kinds of sectors. Anyone who is involved in child and family services is relevant for us to be able to do the outreach. And now we have even started connecting with global providers as well. And recently just hosted an event called Hope Around the Globe, which was really interesting to hear how Hope as a framework can be implemented in global settings. So just to give you a little bit of context again, I want to just describe to you what the project is. So the Faith and Hope Project really seeks to expand congregational home visiting, acknowledge and address the effects of systemic racism when families try to access services and supports, and walk away with a set of products, toolkit, or model for broad replication. So this is really important because as much as we want to talk to parents, as much as Reverend Armstrong works with individuals and families within his congregation, and eventually other faith leaders hopefully will do the same. It's really challenging if when they go to actually seek those services and supports that are needed for the healthy development of their child or children, they're encountering systemic racism as barriers. And so that includes medical, public health, and social services. And of course, in doing this project, we want to make sure that others are able to do so the same. So what is this hope thing that I keep talking about? That is healthy outcomes from positive experiences. And as you can hear, we are really, really good at acronyms. It's actually not me, it's Bob, our leader, who's really, really good at acronyms. And so it's important for us to talk about what that really means, because we're not referring to the word hope that most of us are familiar with. Really, this is talking about how children's brains respond to positive experiences. So for many of us, for many years, we were told that children's brains develop, and particularly if there's a traumatic event or some sort of adverse childhood experience, more than one perhaps, that the brain responds to that. And the story kind of ended there. But one of the things that science has shown over the years as we've progressed is that the brain continues to change and to grow and to develop new networks and pathways. So you first start seeing this happen with stroke, now that we understand and have better imaging, right? The brain is changing. That is what the rehabilitation process is all about, is doing some healing for the brain. You know, learning, meditation, and literacy. I don't know if you all are familiar or have friends who are educators, but many of them will say, oh, there's evidence that the brain changes because children are no longer learning cursive, right? So there are different parts of the brain that are lit up basically and connect with each other, and also post-traumatic growth. And I think we've all either experienced that ourselves or know someone who has. So I don't want to go too deeply into the brain science, but just want to give you a little bit of a demonstration that these are all just like what we call the superhighways in the brain. And they have the ability to rewire. So because one experiences, you know, there's an experience that is in response to a trauma or to an adverse childhood experience, that doesn't have to be the end of the story. The brain can rewire in a different way based on positive childhood experiences. Another one is that we now know that love changes brain function. And that's really critically important when we talk about children, youth, and families. So that's a little bit, not too detailed, about the brain science aspect of hope as the framework hope. And so I want to kind of talk about some of the behavioral science, social science that underlies hope as well. So most of you are familiar with BRFIS surveys. These are behavioral risk factor surveys. And so several years ago now, there were questions added about positive childhood experiences. And what we found was pretty significant. And it gives people hope. So in addition to that brain science, what you see is, we're calling these PCEs, right? Having 0 to 2 PCEs, just about half of the respondents reported poor mental health as adults. But as you go up, you can see by the time you get to 6 to 7 positive childhood experiences, that drops dramatically to more like 13% that report poor mental health. And so that is for all children. And one of the reasons we believe that positive childhood experiences are important for every child. But what about children who have experienced adversity? So when we look at that data, it actually really holds true that even in the face of 4 or more ACEs, which means there's been significant adverse childhood experiences, see that rate of depression or poor mental health goes down as they have access to more positive childhood experiences. So not too long ago, we also found evidence, not us internally, but there's some evidence that has been published, and you see the citation here, that more PCEs actually connects to decreased substance use. And you can see that's pretty much across the board, whether that's tobacco, alcohol, basically any substance use or illicit drug use. So then we sort of ask the question, right? This is really great to know, but what are the experiences that people actually need for this to work, right? We have to take that big idea and condense it down to something that's manageable. And that is the HOPE framework. So what we've done is we've created what are called the 4 building blocks of HOPE. Those are relationships with other children and with other adults through interpersonal activities, safe, equitable, stable environments for living, playing, learning, and Reverend Armstrong will get me if I don't say praying, at home, and also learning in school. The third one is social and civic engagement to develop a sense of belonging and connectedness, which is really important, and emotional growth through playing and interacting with peers for self-awareness and self-regulation. So some of the concepts behind the work that we are doing and how we ended up connecting with faith leaders are about defining community, and Reverend Armstrong will walk us through that.
So one of the things that we have continued to posit in our research is the idea that people choose the environments that are meaningful to them. And so it's not just where they live by zip code. It isn't just their faith community, although I'm a big believer that that is a huge one. For some, it's fraternal and sorority organizations and connections. Wherever there is life-giving, where folk find what I like to call, even for children, affect, nurture, and bonding. And so those aren't just for young children, right? Adults need affection, they need nurture, they need bonding. And where individuals find those 3 things is where they generally tend to call community. We would hope that that's within biological family units, but it doesn't always have to be. Research tells us that the more consistent adults in a child's life, 2 or 3, that is a guiding force for that child in helping to overcome risk factors. And so what we are intentionally, though, with that said, what we are intentionally linking to is the idea that faith communities and religious and spiritual communities are most important, and they are places of this immaterial spiritual connection, but they're also very tangible places that meet protective factors, concrete supports in time of need, knowledge of parenting, and other resilience. And so through faith communities, I have tried to meld my own research with this idea that pastors and imams and rabbis are trusted individuals to whom families look to, not only for guidance and support, but I hope also for information and inspiration. And so through faith communities, we have tried to intentionally meld the science of neuroscience with the science of theology. There's a budding field of growth called neurotheology out there, and I don't go around calling myself a neurotheologian, but it's not too far from where I do see myself. Where do we combine neuroscience and things like epigenetics with theology and things like faith and spirituality? How do those come together to form protective factors and increase children, individual, and communities' ability to overcome challenges in life? So Dr. Henry Louis Gates is a famous historian. I like to call him a religious theologian as well. He has put together a wonderful series about the Black church, and this is going to give you a bit of an introduction to the importance of why the church and houses of worship, but in African-American communities, particularly the Black church, is so very central to this service delivery system.
Christianity and slavery were long intertwined. While masters believed that their religion could be used to pacify their slaves, African Americans transformed Christianity and created a new culture that would serve as the foundation of their freedom struggle.
The oldest independent African-American denomination is the African Methodist Episcopal Church, founded in Philadelphia in 1794 by Richard Allen, the formerly enslaved Black man who
Christianity and slavery were long intertwined. While masters believed that their religion could be used to pacify their slaves, African Americans transformed Christianity and created a new culture that would serve as the foundation of their freedom struggle.
the oldest independent African-American denomination is the African Methodist Episcopal Church, founded in Philadelphia in 1794 by Richard Allen, the formerly enslaved Black man who purchased his own freedom.
Black religious leaders such as Reverend Allen took a strong abolitionist stance, even helping slaves escape through the Underground Railroad. During the Civil War, some served as army chaplains, and once the war ended, many mobilized Black political participation. Some even held public office.
The Black church provided leadership opportunities for men and women who, by and large, were in subservient positions in the workforce. And so all of these preachers doing work in the Black church have been critical to giving Black people a space to envision that a different world is possible.
The late 1800s saw a dramatic proliferation of Black churches, and the church remained central to Black life through the 20th century, particularly at the height of the Civil Rights Movement.
In the 1960s, the church is playing a much more overtly militant and political role in terms of trying to organize people to defeat Jim Crow, end racism, and also to promote economic equality.
The tradition of Black religious leaders shepherding the freedom struggle reached its pinnacle, the Reverend Dr. Martin Luther King Jr. Dr. King fused religion, nonviolent resistance, and the prophetic tradition to challenge Jim Crow, while invoking the musical legacy of the spirituals that enslaved African Americans had created. Today, the Black church remains a fundamentally important institution in the Black community.
The Black church has had to be everything to Black people because American society was unwilling to do so. Today, we don't need the church to do the same things for us, but do I think the church is still a relevant institution? Absolutely. It is the place that you can come and rebuild your spirit after you deal with the spiritual assault on Black life that many African Americans experience because of enduring histories of racism and discrimination.
So with that as a backdrop, I've pastored our congregation here in the city of Trenton for 23 years. My predecessor was the late Reverend Dr. Samuel Howard Woodson Jr., pastored the same church for 53 years. And before him, the late Reverend Dr. John White pastored this congregation for 42 years. So from 1904 to present, there's only been 3 pastors of this congregation, which is very unique. But it also speaks to the central role that this congregation has had on the lives of African Americans and African descended people in the state's capital here in Trenton, New Jersey. Reverend Dr. White was the first founding president of the Trenton branch NAACP. Reverend Dr. Woodson was the first Black speaker of any state legislature in the United States of America. And so I follow in this great prophetic tradition about which Dr. Gates speaks and writes and shares with us through this video. And we believe that it is through that milieu of not just the church, but houses of worship of all faith backgrounds. So we're not just going to be working with Christians, we're working with folk who are Muslim, folk who are Jewish, folk who are Hindu, perhaps even Buddhist, and working with all varied denominations from Catholic to Orthodox to Protestant, different breakdowns of other religious traditions. So I don't want us to get overly focused on church as much as we are connecting faith leaders of all faith traditions into this health equity work.
Thank you, Reverend Armstrong. And so I want to just kind of show how we have made this sort of transition, as you can see, in thinking about the work of hope, the anti-racism hope that we are pursuing, and how people define their communities. And the Black church, of course, as you saw in the video, is one significant part or aspect of community by which people define themselves. And Reverend Armstrong is correct. So one of the things that we want to just make sure to be really clear about is we're approaching this from the perspective that the Black church is an important community institution. That does not mean that other faith communities don't have impact on people of color. And in fact, we won't really be able to address systemic racism without bringing like-minded people of all faith communities together, because oftentimes religion has been used as a tool to prop up systemic racism. So just want to acknowledge that we're not saying that the Black church or Black people are the only people responsible. People of multiple faiths have wrongs to right. So this is just a really quick, short illustration of that. And then we'll talk a little bit more, Reverend Armstrong will talk a little bit more about how faith impacts parenting.
One way of thinking about religious contributions to racism is to see them as rationalizations for racism. So one way that you might think is that religious sensibilities, particularly in the Western world, it's Christian religious history, was carried along by the cultural currents that gave rise to racism. So racism you might think of as a way of some people becoming dominant over other people, and that having that dominance being expressed economically, socially, politically, in all kinds of different ways. And you can think of religion as kind of a technology, sort of a way of securing that relationship of dominance and subjugation. But another way of thinking about religious contributions to racism is not as you might say post hoc or post facto rationalization, but instead an engine of racism. That is to say, you can think about racism as having arisen from religious reasoning. And I think that Christianity in particular has given rise to race-based thinking in the Western world. And the historical progression of Christianity includes a very deeply embedded kind of race-based thinking that modern Western Christianity has not adequately wrestled with.
Great. So I just want to, take a moment to make sure that we're all on the same page with this, and that it's really important to address systemic racism, that we do include faith communities of all kinds. In particular, when we talk about dismantling systemic racism, the Black church, of course, is an institution. And that is how, as you heard from Dr. Henry Louis Gates, we've made the significant progress that we have to this point. And there are other faith communities that have a role in this as well. And the work that we are doing, we hope, will be able to spread to those groups as, in addition to the one that we are addressing today. So now, Reverend Armstrong will talk a little bit more about how faith impacts parenting.
So just a little note about where even the name hope and faith have come from. Dr. Stevens has talked to us about what hope as an acronym stands for. But as she mentioned earlier in our presentation, when one hears the word hope, one tends to think about the phrase or the word in a religious context. Within Judeo-Christianity, hope is a very prevalent word, particularly in New Testament scripture writings. Paul, Jesus have all referenced it. One of Paul's great quotes from which this very project takes its name, now abideth faith, hope, and love. The greatest of these three is love. And so Dr. Sagan and I have long kidded, joked with each other that the third component that we're going to add to this network of work that we're doing together is love. And we're creating an acronym around that. But hope and faith are very intentional because not only are they scripturally rooted, but it speaks to what I believe is tradition of a liberationist thinking around one's spirituality. And so what we just showed you was the sad history of how religion has been used to oppress. And we can think of many ways in which the scriptures have done that. Women, be silent. Slaves, obey your master. When you take a fragment of scripture out of context, that's called eisegesis. But when you look at scripture in the context in which it was written holistically, that's called exegesis. And so what Dr. Sagi and what Dr. Stevens and I are interested in is not eisegesis, how has scripture limited and oppressed, but how does scripture liberate and open up and empower? And so the acronym, the other part of our acronym is FAITH, which initially, when I created this organization in 2020, represented the acronym Faith Leaders Against Abuse in the Home. But, you know, Dr. Sagan and I have talked about this notion of how do you lead with a strength-based perspective? And so I want to credit him even with this notion of the new FAITH acronym, which we now entitle Faith Leaders who are aligned and allied to institute trust in the home. So just telling you what we're against in terms of faith leaders against abuse, child abuse, elder abuse, any type of abuse, it isn't enough for us to say what we're against. We also must say what we're for. A very wise preacher told me long ago, the absence of one thing does not mean the presence of another. I know what we're against, but what are we for? Tell me what you're for, Pastor Armstrong. What do you want to see in families in your congregation, or rabbi in your synagogue, or imam in your masjid? What do we want to see? And so now I like to say that we're doing business. Faith Leaders Against Abuse in the Home is also doing business as faith leaders allied and aligned to institute trust in the home. And with that trust comes confidence and peace and a certain sense of connectedness that we want to see happen in homes. Really positive experiences. When children are surrounded by affection and nurture and bonding, we know from the essentials of early childhood that produces safety, stability, and well-being for children. And I would say not just for children, but the families in which they find themselves and the communities in which those families find themselves. So this graph on the right is a research graph that I often use in my presentations to elevate the importance of faith, religion, and spirituality. And in this case, particularly in the context of parenting, my friends at 0 to 3, Claire Lerner, who's no longer there, and others, they did a research study in which 17,000 parents were studied. Heart Research Associates did this research, asking the questions such as, what's the biggest influence on your approach to parenting? And you see the biggest influence is how we were parented. Makes perfect sense. But look at the second biggest influencer of parenting, my faith and my religious background. And when you combine the light blue grayish box with the purple box, even with the yellow box, the great majority of those who were polled are very clear that their faith tradition impacts how they parent. Now, that can be both to the positive and to the negative, right? And there's a whole nother conversation about corporal punishment and how scripture has been used to justify corporal punishment. But again, that scripture that has been eisegeted, not exegeted, taken out of context to support one's position and hypotheses. Research has long supported the idea that faith is important when it comes to parenting. Abraham Maslow's hierarchy of needs tells us that after we get through our base needs and functions at the highest level of that pinnacle of the pyramid, often is called transcendence or enlightenment. But in rare cases, you will see the word spirituality used at the top of Maslow's hierarchy of needs. It's that kind of research and science that leads us to say religious partners cannot be ignored when it comes to child and family well-being. And what we're trying to do in faith and hope and faith is to connect the science of well-being with the theology of well-being to help families overcome and to thrive, not just survive.
Great, thank you. So I just want to go back really quickly. So once we made these connections, we did decide that we wanted to start combining faith and hope. So thank you, Reverend Armstrong, for that example. Reverend Armstrong also helped us to put together a toolkit for faith communities that we have today, and also participated in a podcast and did a webinar similar to this called Hopeful Conversations. And it was specifically about hope in faith communities. So I know we don't have a whole lot of time left, but really quickly want to explain the concept of congregational home visiting, and then just give you some highlights of the actual research project that we're doing. Reverend Armstrong, did you want to explain congregational home visiting?
Yeah, if we have the slide with all the home visiting programs on it, do we have that one?
They're listed on this one.
Yeah. So home visiting, when I worked in state government and ran the Division of Child Abuse Prevention and Community Partnerships, from 2006 to 2009, home visiting was just starting as a federally funded program. In point of fact, HRSA lists 2010 as the first authorization of funding for home visiting. Before that time, several models had been in existence at various degrees of impact around the country. Nurse Family Partnership has a rich history of working with trained nurses and sending them into homes. Healthy Families is the signature project of Prevent Child Abuse America. It is in at least 48 states that has PCA chapters, and each of those chapters have several sub-chapters of Healthy Families that are doing healthy home visiting programs, Parents as Teachers, HIPPY, Head Start and Early Head Start, which grows out of the Great Society tradition of the TRIO programs and educational equity. So various models existed, and even in the state of New Jersey, various models were competing for access to some of our state funding. And we were very intentional when I was the director to not preference one model over the other, but to really weave them together into a universal network of home visiting. One of the books I have in the back of my head is that Jesus was a home visitor. And this notion that home visiting is nothing new. It's not a new concept. The idea of being welcomed into people's homes and going into people's homes is very important. So when I left state government, I still pastored my church. And the idea of how do we take the science and the operationalization of home visiting and marry it with congregations, almost in the parish nurse tradition. And so congregational home visiting was a promising model that I founded back in 2000 2010 that simply says, before a pastor or imam blesses a child, that's my son Daniel, being held by one of my early social workers through my time in the Los Angeles child welfare system, Roberta, who is still living with us, 88 years of age, wonderful spirit, one of my angels along my path to overcoming as a survivor of child abuse. Before we bless a child, christen a child, perform whatever baby ritual your faith tradition has, use that window of opportunity to actually engage the caregiver, parents, hopefully, biological, hopefully, or caregivers in a series of trainings around early childhood development. And doing that very much in the way we do premarital counseling. I now call it pre-baby blessing, pre-baby dedication counseling. Mayors kiss a lot of babies. Presidents kiss a lot of babies, but religious leaders, it is the sole responsibility of religious leaders to dedicate, bless, baptize, christen those babies. And so we are absolutely at ground zero, faith leaders are, when it comes to early childhood engagement. Not getting into the policy debates about family leave or universal child care, the very basic point that a child has come and been given into the hands of this family, how do we best help them to wrap around that child, to love them to life? Why would I want you to love me to death, right? I even changed the name. Love someone to life. And the baby congregational home visiting does not displace those models in NFP, HFA. It complements them, because I say to Dr. Melissa Merrick at Prevent Child Abuse America or David Oates at NFP, we want your home visitors to see them Monday through Friday, but we have the rich opportunity to see them Fridays, Saturdays, and Sundays on the weekends and complement the messaging of early childhood development. So we assign in the congregation trained home visitors who work in tandem with the social service home visitors. And that connection, we believe, to be powerful in helping them to have health equity access, but also access to so many other resources. And imagine if your pastor or imam did the first home visit after you announced to the world that you're expecting. So this is the power of congregational home visiting being married to the science of social service, McVie-funded maternal, infant, early childhood home visiting models.
Great, thank you, Reverend Armstrong. And I know I said we were going to give quite a bit of background and context, and so we have. You see how faith connects with hope. So I want to just take a minute to kind of go over the steps that we will be taking, the content of our actual research. So the first thing I just want to highlight is that we are prioritizing lived experience. You heard Reverend Armstrong mention briefly his own lived experience. That's important. We also talked about Amber, who is our parent leader and advocate, and she is included as a member of the research team. We also allocated in our budget for participant support funding to help to make sure that people are able to, and that they understand that they are a valued part of the process and the research. We'll be conducting a racial equity needs assessment, and we'll also get feedback from faith leaders. So it's like this moved. In the racial equity needs assessment, the idea is to actually understand the the barriers to services and supports in all of those three systems that we discussed, because that way we can directly address how systemic racism manifests. So what does it actually look like? And so it really shifts the focus from fixing children and families to actually dismantling racism. So oftentimes we hear about people they distrust a system. Well, we have to actually move it from trying to push children and families into having a different belief system or a different response to organizations and systems that are steeped in racism, and actually dismantle the racism. So one of the things that we found is in trying to do that, we have had to start creating our own tool. The two that we found that were closest related to what we wanted to do were the Perceived Ethnic Discrimination Questionnaire, the community version, and the Perception of Racism Scale. And as I'm talking, you can hear that already it's about perceived discrimination and your perception of racism. And so we want to take a different approach and really talk about what happened and how is this manifesting. And it's not just your perception. It's not something that you're just seeing and it's because of you. What is it that's going on? Because we know that systemic racism exists. But we also need the tool that's going to focus on interactions with systems. And most of these are general. So it's, what's happened throughout your life when you're at the grocery store, some of these other things. So we have had to kind of go to the drawing board and, directly create a tool that can combine that focus on the experiences, that lived experience of children and families in those systems, and also focus on interactions with those systems specifically. Next, we will have working groups. So we have equitable partnerships and decision-making authority in these working groups. There are 3 systems represented, and Reverend Armstrong, having had the long and distinguished career that he has described to you in his community as the pastor of Shiloh Baptist Church in Trenton. He's been able to pull together an amazing group of partners and organizations from all 3 of these systems, and also figures in public policy as well. But to be able to participate in the working groups and to actually have those equitable partnerships and decision-making authority, it really requires some training for any faith leader participant, systems executives, and parents. So really quickly, parents are not used to sitting at a table across from an executive and being considered, as equal. So that takes a little bit of a change in mindset, and also requires the opportunity to build some skills. So that's something that Amber is helping us with. And systems executives are not used to sitting with families and relating to them as equals. And so that will take some nurturing and some skill building to be able to achieve. So our evaluation methodology is a quality improvement statistical process control. There's information here about how that will work. The one thing that I hope you'll notice is at the bottom in this really important study that established this particular type of evaluation, the quality improvement statistical process control. The person here, Mary Catherine Arbor, so she actually helped to develop this, and she is also our evaluation consultant on our research project. So we're really, really thrilled to be able to work with her on this because she was one of the pioneers of this method. And finally, we are going to have some research products. And so at the end of this, we will have, first off, the results of that racial equity needs assessment, right? So we're going to have a better idea of what is happening and what systemic racism really looks like in these systems. We're also going to have training curricula, which we discussed, but we'll be able to have that. It'll be packaged and it can be a product. We'll also have the specific methodology from the quality control process that we just talked about. So that will be, together and available for future faith leaders or organizations to be able to incorporate into any congregational home visiting plan that they have. And then, of course, the working group accord. The idea is that everyone comes together and there's some sort of agreement and understanding that will allow changes within those systems to mitigate some of the manifestations of racism that people are encountering. So with that, I want to transition really quickly to a statement that we had. Amber, who is our parent leader, was unable to make it at the last minute. And so she sent a statement for me to read. So that's Amber. Okay. So I'm going to come off share. Okay, so she says, good morning, everyone. I hope you're having a powerful day. My name is Amber Robinson, and I'm a community advocate and resource connector in the Guilford County area, North Carolina. I'm a COFI, Community Organizing and Family Issues trainer, and a HOPE, Healthy Outcomes from Positive Experiences trainer as well. I also create enriching workshops. I created a curriculum for the parent training that is one of the components in this grant. It's a training that focuses on bringing hope to oneself, family, and community, and also focuses on advocacy strategies for self, family, and community. People in marginalized communities are suffering health-wise all over the nation. Some of it is due to systemic racism. This means a lack of access to quality healthcare that prioritizes them being healthy. Some of it is due to a lack of community support. This could mean a singular person coming up against all the barriers in a community alone and without guidance. And some of it is due to not making a healthy self priority from day to day. And this could mean being a singular person shouldering the responsibility of everyone in the household and all that goes along with that. This often leaves no energy for self. Some of you can relate to this because it's a national problem, but it gets exacerbated in certain communities. Faith communities provide a built-in intergenerational support system and network that when the members are given the proper tools, information, and resources, they can be the beacon that the greater community can be supported by and model. By bringing the HOPE framework and advocacy strategies to congregants, it creates a ripple effect that will fortify a culture of health equity and accountability. And with RWJ, I think we would say a culture of health.
Before we open up and finish up, let me just say one last thing. We have geographically focused on the city of Trenton. And so our research and our partnerships are localized, but we hope that what you see coming out of our research in Trenton can be then transported to faith community or similar communities throughout the United States of America and even around the world. Trenton is a unique city, but it's not so unique from its issues of implicit bias and structural racism. 10 years ago, 90% of the babies born in our area in one of the richest counties in America, Mercer County, where Princeton University sits, and Pennington and Hopewell, some of the richest communities in America. Trenton sits 20 minutes away and is always listed as one of the most economically challenged communities. I don't say poorest, economically challenged communities, under-resourced, some might say. And 90% of the babies born 10 years ago were born in the city of Trenton. Today, no babies are born in Trenton. They're born in Hopewell. They're born in Princeton. New $500 million medical facilities have been built, not in the inner city of Trenton, but built in the suburban communities that are overwhelmingly wealth resourced. And so mothers in Trenton now have to catch cabs or Ubers or Lyfts to go do their baby well checks from the inner city of Trenton to the suburbs of Hopewell and where Capital Health System is, and Princeton Medical Center along Route 1 corridor in Princeton. That is not perceived structural racism. It's perceived it is realized challenges that some may say is not race-based, but you cannot escape the reality that those who live in Trenton are predominantly Black and brown, and those who live where the medical facilities are located are not. And so this project is addressing a trend going on around the United States of America. Urban hospitals are closing, suburban hospitals are booming, and mothers in those communities that are under-resourced need to have the same access and equity given to them that it should be extended to any mother who is pregnant. So we're excited about what this portends for not just Trenton, but for communities like Trenton all over the United States.
Preach, Reverend Armstrong. Thank you for sharing that. And thank you for the research team for putting together this presentation and for sharing some background information on how Faith and Hope came to collaborate together and talking about what you're going to be doing in your research project moving forward. I know at the program office are excited to have you for the next couple of months as you complete your project, and excited to learn alongside you. And I'm sure some of the attendees here are also excited to learn what you're learning. So speaking of that, 2 easy ways to follow along with this project. I know my colleague Sadina Bamashkin posted the website link for this project page in the chat. If she will post that again, just in case anyone missed it, you can follow along on their project webpage. Any products that come out along the way or any presentations that they're giving, those will all be posted on their webpage. And then we will also have this team back to present on their final findings once their developmental project is over. So with that, we have a couple of minutes for questions. I saw 1 or 2 come in. If you have a question and you haven't entered it into the Q&A box yet, please don't hesitate to do so. I know we only have 4 minutes, but we can always have the research team reach out to you if you do have some questions that we don't have time for. So the first question we have is, how did you obtain buy-in from social services and home medical providers to partner with religious organizations in order to implement the home visiting experience?
It's been a process, and one that has been built on trust and relationships, like most things in life. I've been in New Jersey for 27 years. I've worked at our congregation for 23 years. Our congregation is 143 years of age. And so even though we only had 3 pastors in the last 118 years, we have been in existence for 143 years. We're the oldest Black Baptist church in the city of Trenton. So we have some social capital that we have used diligently to build relationships and collaborations. And so whether it's our local FQHC, Fairly Qualified Health Center here in J. Austin, Dr. Kimmy Ali, or the 2 medical centers and systems, Capital Health or Robert Wood Johnson Barnabas, or the Central Jersey Maternal Health Consortium, these are built on existing relationships. This was not the first time they heard from me, and it's not the first time I've heard from them. So we work in collaboration, and that made it easier to bring folk to the table.
Great. And it really just speaks to the need to actually connect with people in the community. I cannot, from Tufts University or Tufts Medical Center, kind of dictate and call up and make those relationships happen. That is why you have to kind of lead with that lived experience, value people's expertise. So Reverend Armstrong is coming in with expertise about his community, who the key players are, how to persuade them to participate, and all of those years, as he said, of just working the community and developing that. So it's really important to make sure that these kinds of projects are led by the community.
Absolutely. Thank you both. And then the last question that we have here is in regards to your assessment. I'm curious if that's something that you're willing to share at this point, or if that's something that you might want to share at a later point in your project when your assessment is complete.
Yeah, I think we'll wait to share, because right now we're creating it and we're going to use it, right? So for the first time. So I think once we kind of see how it goes, we can later, I think we have to present again. We'll probably share the results of that racial equity needs assessment, and of course the tool at that time. So eager to share it, but want to make sure that it's an appropriate product that others would want to use when we do share it.
Absolutely. So I guess short answer, stay tuned. Come back for the next research and progress webinar. Okay, so that is all of our questions, which is actually perfect timing. We have 1 minute left. I just want to thank you again for putting together this presentation. And I want to thank everyone who has attended. Like I said at the very beginning of this webinar session, this is an ongoing, recurring webinar series. Our next presentation will be from a grantee at Case Western Reserve University, presenting on their project, an aligned delivery and financing model to address food insecurity and social needs of low-income pregnant individuals. We will include registration information for that in our follow-up email to everyone. That will also include the recording and slides from today's session. So again, thank you for attending, and I hope everyone has a wonderful rest of their day.
Thank you.
Thank you.